Hi, everybody. Thank you for joining us for our presentation titled Findings from 3 Youth-Led Nationwide Text Message Surveys of Perspectives on Adolescent Health. My name is Hannah, and I will be presenting with our team, which is the MyHealth Impact Projects team.
In MyHealth, we are a big team of high school student researchers who live in Michigan and university researchers from the University of Michigan. Shown above are some of the student and staff involved in the project here to present to you today.
We have worked with MyVoice, a national text messaging poll that allows young people ages 14 through 24 to voice their opinions on important policy issues. There is a diverse group of about 1,000 youth and adolescent participants across the U.S., representing every state. Each week, participants receive 4 to 5 open-ended questions about an important research topic. The participants are compensated $1 each week they respond to the survey questions. As a MyHealth team, we have explored different research topics and created survey questions that were sent out to the MyVoice participants. Our goal is to amplify youth voices in order to make a difference and inform policies in real time.
So we collected data from 791 youth ages 14 to 24 from around the United States who were enrolled or re-enrolled to the MyVoice program in the summer of 2022. Most of the enrollees were recruited via social media. The youth participants were sent a unique 5-question open-ended survey each week. And those surveys were created by each of the 3 MyHealth groups of students, and some of whom you'll meet here today. Each group worked together to create their unique survey question set based on the research question that they developed. In our final stage, the text message responses were analyzed by MyHealth team members using inductive thematic analysis to sort the data into common major findings.
And here is some insightful demographic information regarding the MyVoice participants. Our findings really shed light on the diverse makeup of individuals involved in the MyVoice initiative. So we found that the average age of our participants was 20 years old. And in terms of gender representation, it was observed that 48% identified as female, 40% as male, 5.9% as non-binary, 3.8% as trans male, and 0.4% as trans female. Furthermore, we found that in terms of race and ethnicity, 63% identified as white or Caucasian, 16% identified as Asian, 10% as Black or African American, and 7.5% as mixed race, as well as 11% in Hispanic. Moreover, in terms of educational attainment, we found that 62% have completed at least some college, and lastly, 36% have received free or reduced lunch during their time in school.
Next, we're going to cover the results from our first survey.
Our research question was, how has COVID impacted how youth aged 14 to 24 view their future? MyVoice survey questions asked, how do you feel when you think about your future? How has your future plans been impacted by the COVID pandemic? Has your level of anxiety about your future changed from before the COVID pandemic? What resources were available during the COVID pandemic to help you manage anxiety about your future? And what would help support youth in managing anxiety about their future now?
One of the main themes shown in the responses was increased fear and anxiety due to the uncertainty of the future caused by the pandemic. 37% of respondents felt uncertain or unsure about their levels of anxiety about the future. Another 37% of respondents felt increased anxiety levels about the future, some saying that it has permanently altered so many things and the sudden changes with everything are what made my anxiety rise. Only 7% of participants reported decreased anxiety after the pandemic, and some reported that their levels of anxiety increased during COVID, then decreased.
Our second finding was that very few youth reported a positive impact of the COVID pandemic on their future plans. 34% of respondents reported no or minimal impact to their future plans from the pandemic, while almost 30% reported negative impacts, such as delayed or canceled plans, declines in mental health, and lack of financial stability or career opportunities. But only 12% reported a positive impact, such as opportunities to further their academics or career.
Our third finding is that youth felt that they did not have many resources to help them cope during the COVID-19 pandemic. When asked about what resources were provided to them, one participant asked, "What kind of utopia do you think this is?" implying that helpful resources are not readily available in our society. Another participant talked about how alone they felt without any kind of support. From the responses of the youth, there seems to be a clear need to address youth anxiety about the future during COVID.
The fourth theme that we found to be prevalent was the emphasis for anxiety in support groups. Youth agree that support is important for managing anxiety and support. There were many different forms of support that included social support of family, friends, social media, and professional support of therapy and guidance.
Next, we'll cover the results of the findings from our second survey.
Our team is made up of high school students who have experience with health education in schools. This topic was mostly chosen because of the rise of misinformation about health on the internet and social media. Our team conducted a survey on how youth feel about their experience with health education in schools and improvements to health education. These are the specific survey questions that my team came up with in attempt to better understand a research question. They were geared toward understanding youth perspectives on health education in their respective schools. We wanted to understand what participants learned in health education in school, what they wish they learned, where they learned health information, and how health education can be made better. From our very first survey question, we learned that health education was very outdated and limited, and overall wasn't inclusive or comprehensive, leaving past and present students with no understanding about the subject and even a biased view of it. This can be very harmful because it leaves students very ignorant on ways to treat their health, and the health education system needs a revamp so it can better improve on its academic teachings and to lessen dangerous ignorance. For example, a 23-year-old male from the Midwest stated, "It was a joke, very limited and outdated information, but at least taught the basics." And a 20-year-old female from the South stated, "I think they did a better job of teaching physical and nutritional health at lower levels of school, but my district had no semblance of sex ed curriculum, which I think is really bad."
Our second major finding from this research set was that health education should be transformed to be more inclusive and representative of all individuals with a focus on curriculum that is tailored towards the students. Many participants were unhappy with the health education they received and shared what they wish they learned more about in order to be better prepared in their lives. They expressed their desire to learn more comprehensive sexual education, including the LGBTQ community, STDs, and mental health. Specifically, a transgender male participant noted the importance of the language used in our health education curriculum to avoid fat phobia, homophobia, transphobia, and racism.
Why are schools' information so outdated? Participants in our study expressed concerns about lack of funding and lack of standardized training that contribute to poor quality education. You describe how for some schools, it's common to merge gym class with health class and only scratch the surface when it comes to the curriculum. Following the same basic cookie cutter topics every year, that's left them without comprehensive health education. For example, one participant said, "Make health a full class, just not a week, instead of doing gym class, and have actual comprehensive health topics and not just barely touching the minimum." And another participant described how some common topics that were missed from health education in schools due to lack of standardization. A 20-year-old female from the West stated, "Health education needs to be completely reworked to be standardized across states with more information about women's health, contraceptives, and mental health." which brings us to our next slide on the solutions students come up with in response.
So our last question explored where youth are learning about health outside of school. And as we expected, the internet was their primary source, followed by family and friends. The quote from the 22-year-old trans man suggests that while some respondents use reliable sources such as Planned Parenthood, a lot of youth are prone to using TikTok and other unreliable platforms to gather health information.
And last but not least, we'll cover the findings from our third and final survey.
Healthcare accessibility and reform have been hotly debated topics in the United States for years. While progress has been made in expanding access for many Americans, concerns remain about the availability and affordability of healthcare services. And given that youth represent a significant portion of the American population and will be the next generation to shape the healthcare landscape, it is crucial to understand their perceptions and experiences with the healthcare system. So, to find out more about this generation's perception of healthcare, our group developed the research question: according to youth ages 14 to 24, how accessible is healthcare in America, and what is their role in improving the healthcare system in the future? These are the specific survey questions that our team came up with to further investigate our research question. The first two questions aim to gather the opinions and experiences of young people regarding healthcare accessibility in the United States for themselves as well as for others in their age group. The third focuses on identifying the challenges young people face in accessing healthcare, while the fourth and fifth questions are about potential solutions to improve access to healthcare and the role youth can play in making that happen. After sending out these responses, we soon got responses from youth across the United States. We then gathered and sorted the data to find three major themes, which we will be exploring in the next 3 slides.
Our group noticed that a lot of the respondents talked about a lack of accessibility to healthcare. For example, one respondent said this: "I feel like I do have enough access to healthcare when I need it. I would like it to be free. It's so expensive to get just a checkup. So very thankful that I'm under a low-income family and get insurance for cheap." Another respondent replied to the question saying, "I think healthcare could be more accessible. A lot of people don't have access due to cost, location, or availability." Through these examples and many similar responses, we were able to see a theme that although healthcare may be available, oftentimes it's not easily accessible for youth.
Furthermore, the availability of adequate healthcare is not only a fundamental human right, but also crucial for the well-being of every single individual. Sadly, numerous young people encounter significant challenges when it comes to accessing essential healthcare services. Our research indicates that the most common obstacles reported by youth are concerns regarding privacy, followed by financial constraints, followed by limited knowledge of healthcare system, including transportation or geographical barriers and cultural disparities. Moreover, regarding the issue of privacy, one participant even said, "Most of accessing healthcare for youth is through their parents, which also brings up issues of privacy for things like accessing sexual healthcare or gender-related healthcare." Moreover, many other participants expressed concern regarding the financial burden associated with healthcare, and many young people, regardless of insurance coverage, touched on the fact that healthcare can be expensive, and many young individuals may not have the financial resource to cover the cost of healthcare expenses. One participant said, "The cost of healthcare is prohibitively high for young people with and without insurance."
Based on the issues within the healthcare system, our third theme includes solutions the youth believe can be imposed, which includes lobbying and protesting more often to put officials, both locally and federally, into office who will act upon the youth's requests for healthcare changes. The youth could also provide first-hand feedback based on experience and opinions to act upon the changes. However, not all youth believe certain changes can be done, as statistically only 18% of youth believe they can actually impact the healthcare system. Some believe that in this current system, the youth have no role in making an impact. Some also argue upon the fact that youth don't have the required knowledge about the healthcare system to act upon changes.
Overall, the findings from our survey gave us more details on the problems that youth face. Youth particularly feel like their perspectives are important, but their voices are rarely heard. Because of such issues, adolescents feel as though they need additional resources and support. In the future, we hope to share findings with people who work with youth, like school counselors, teachers, doctors, and policymakers. We also hope to inform and lobby for better policies and better access to healthcare services for youth. After further analysis of the survey responses, we will share findings and articles online, through social media, and locally through our schools. Thank you very much for your time. We are happy to answer any questions.